I guess I'm live now. Can you give me a thumbs up in the chat box if I'm clearly visible, audible, and my PPT is also clearly visible to you? Can any one of you give me a thumbs up in the chat box? Abhishek, Vikas, Kumar, anyone? Krish, is it? Okay, okay. So can we start ahead? Can we start? Okay, okay, okay. So a very good evening to all of you. I am Dr. Priyanka Sachdev here, and today I am here to take a rapid revision for the microbiology for the upcoming FMG exam. Right. So, okay, we all know that FMG is a little bit delayed, of course, but we don't have to waste time. We have to utilize that time, the time which we have got additional, the time because of the delay of the exam in revising. The more we revise, the more we retain, the better we perform in the exam. That is the strategy. So, revise more as much as you can. So, we people are here as a team to help you for the revision. So, I am here. Okay, so बहुत सारे channels पे revision चल रहा है ना. Okay, anyways, so I am here to take a rapid revision for the microbiology right now. For the next 2 hours, we will be live and I will help you in revising the microbiology revision. So how I will help you in revising? In microbiology, in today's session, in special session, I am give you all the mnemonics. So in 2 hours, I will give you 70 to 80 mnemonics today that will help you in better retention of all the list of the microbiology, of all bacteria, viruses, parasites, everything. And if you learn, believe me, if you learn all these mnemonics now with me only right now in 2 hours, I will help you in retaining all those. You can crack maximum MCQs in your exam from these mnemonics only, right? So without wasting any further time, I guess I must start. Okay, so let's start with bacteriology and general microbiology mnemonics first, right? So let me start with the first one. Do you know what are Koch's postulate? What are Koch's postulate? There are only 4 bacteria. We have millions of bacteria, right, in this world. There are only 4 bacteria which do not follow Koch's postulate. Rest all the bacteria follow Koch's postulate. You got my point? You must know the 4 exceptions. It's a very important MCQ. Repeatedly asked in your exam. Name the bacteria which do not follow Koch's postulate. Okay. So the mnemonic is no LPG gas. I have put the word no to make you remind these are the 4 bacteria which do not follow Koch's postulate. No LPG gas. No means they do not follow. So what is the full form of LPG gas? So here L stands for Lipri, Mycobacterium Lipri. P stands for Palladium, Trypanoma palladium, the syphilis bacteria, right? G stands for granulomatous, right? It is Klebsiella granulomatous. And another G stands for gonorrhea, that is Neisseria gonorrhea. So these are the 4 bacteria, that is L, P, G, gas, the 4 bacteria which do not follow Koch's postulate, so no LPG gas. Can you tell me the full form? Anyone? What is the full form? Write down. L stands for Lipri, Mycobacterium Lipri. P stands for Palladium, it's Trypanoma palladium. We are having 2 G's. One is gonorrhea, Neisseria gonorrhea, and another is granulomatous, Klebsiella granulomatous, right? Now this mnemonic is about the genus, the name on the genus, you know, the surname of the bacteria, not the actual name. So you have to learn these 4 bacteria anyway, right? Now, I will show you MCQ also, which is asked in PYQs of FMG based on this mnemonic. Don't worry. But before that, you must know what are Koch's postulate. You want to know what are Koch's postulate? We know for any disease, there is a bacteria, infectious disease I'm talking about, which cause that disease. So this is the cause and this is the disease, right? Just for example, say Corynebacterium diphtheria is a bacteria which causes a disease. The name of the disease is diphtheria, right? Now it is proven. We all know that. If I say, you will say, ma'am, yes, we already know that, right? If I say streptococcus, you will say it causes tonsillitis, right? Likewise, there is a bacteria which causes a disease, right? But to prove it, you have to prove 4 Koch's postulate. If I say any bacteria and any disease, if I say this bacteria causes this disease, you will say, ma'am, how you will prove it? First, you have to prove it. We cannot believe you. You have to prove it. So for proving, we have to see there are 4 Koch's postulate given by Robert Koch, the name of the scientist, right? Now, these are the 4 Koch's postulate. What does it mean? These are the 4 Koch's postulate. Let me explain you. This is an organism. This is an animal you can see. This is the diseased one. So if you take the blood sample of this organism, you can see that that particular bacteria is present in the blood of this organism. And this is a healthy animal. Can you see this one? This animal is healthy. If you take the blood of this animal, you cannot see that particular bacteria. So my point is that the organism is present in the diseased animal and absent in healthy animal. This is first postulate. This should be proven, right? So all the diseased animal of that particular disease, they should have that bacteria in their blood, and all the healthy animals do not have that bacteria in their blood. The first Cox postulate should be proven. Number one. Number two, from the blood, you should be able to isolate it on a culture plate. Number two. You can see I am isolating it on a culture, the culture plate. Blood culture, nutrient agar, any culture. Number two, isolation is important. Number three, I can see colonies are formed. Can you see? These are the colonies formed on the culture media. If I take one of the colony and inject it in a healthy animal, the healthy animal also become diseased because I have injected the culture, the isolated colony, and I should be able to re-isolate it. So these are the four Cox postulate. Give me a thumbs up. Everyone give me a thumbs up, right? So if you want, just suppose I am proving that I am saying you a particular bacteria causes a particular disease, right? If I say anything, this bacteria causes this disease, you will say, ma'am, we don't believe you. Can you prove it? It is the first time you have to prove it. So I have to prove the four postulates that the particular bacteria is present in the diseased animal, not in healthy animal. I should be able to isolate it. After isolating, if I am injecting in a healthy animal, the healthy animal should have the disease and I should be able to re-isolate it. Give me a thumbs up, everyone. So all bacteria in this world, millions of bacteria, they follow these four Cox postulate, except four. There are four exceptions which do not follow it. Can you tell me the exception? The exceptions are LPG gas. You already know the full form, I guess. Can we move ahead? Can we move ahead? Yes, we should. Can you help me in solving this question? It is your PYQ. One of your PYQ of FMG exam. All of the following bacteria fulfill Cox postulate except. Can you read the four options? Write your answer in the comments. Right? Is it Treponema pallidum? Is it Yersinia pestis? Is it Bacillus anthrax? Is it Helicobacter pylori? So everyone is right. Right? Just apply the mnemonic. It's as simple as that. LPG gas. So I guess pallidum ka P is coming in P. Right? So yes, you all are right and you got it. So this is the correct answer. Coming on the next mnemonic. The next mnemonic. I have told you there are hundreds, thousands of bacteria, right? How many of them have capsule? How many bacteria have capsule? There are only 9 bacteria which have capsule. Rest of them don't have capsule. Only 9. Ginti ke 9 hai. You should know the 9 names. 1, 2, 3, 4, 5, 6, 7, 8, 9. That's it. Rest all bacteria do not have capsule. So there is a mnemonic for the 9. The mnemonic is in front of you. I will write it also. It's Pakib, P-A-K-I-Y-B. Pakib MCV. In pathology, we have MCV, MCH, MCHC. You know that? So MCV like that, you can learn. Or PAC, you know, PAC cell volume. So it's Pakib MCV is the mnemonic. You have to learn the mnemonic. So say the full form. Say the full form. Pakib MCV ka P stands for pneumococcus. Right? Pneumococcus and meningococcus, both coccus are there. One is pneumococcus, one is meningococcus, right? So Pakib MCV में दोनों हैं. A stands for anthrax. A stands for anthrax. K stands for Klebsiella. I stands for influenza, right? Y stands for Yersinia. B for Bordetella. M for meningococcus. C for Clostridium. Only 2 Clostridium have capsule, not all. So Clostridium perfringens and Butyricum. And V stands for Vibrio. It's not Vibrio cholerae, please. It's Vibrio parahemolyticus. Can you help me with the 9 names? Who will help me? The mnemonic is, okay, just a second. The mnemonic is Pakib, P-A-K-I-Y-B. Pakib MCV. This is the mnemonic. Say the full form, come on. You can't believe many MCQs will be solved based on this mnemonic. You know, either there will be a direct MCQ, which of the following is a capsulated bacteria, which of the following is a non-capsulated bacteria. But there can be a big clinical questions in which you will get a clue that one of the capsulated bacteria causing this. So you will have differentials in your mind, right? P stands for pneumococcus, M stands for meningococcus. मुझे ये दोनों साथ में याद आते हैं, right? So pneumococcus and meningococcus. So pneumococcus, meningococcus. A for anthrax, right? K for Klebsiella. I for influenza, Haemophilus influenzae. Y for Yersinia. B for Bordetella, not Brucella, it's Bordetella. C for Clostridium, but only 2 Clostridium, not all. You have to say it's Clostridium perfringens and Butyricum. Not all Clostridium have capsule. Right, only 2 have. V for Vibrio, but it's not main Vibrio, Vibrio cholerae. No, no, no. It's Vibrio parahemolyticus. So please, right, say it again and again to learn. Now have a look on the question based on this. Can you solve this question for me? It's again your PYQ. You can just apply the mnemonic and solve it. Which of the following is a non-capsulated? Which of the following is a non-capsulated organism? Right, apply the mnemonic. So I'm writing the mnemonic. Pachyb. What is the correct answer? MCV. So some are saying B, some are saying D. What is the correct answer? Okay, let me help you. P, Pneumococcus coming in this mnemonic. M, Meningococcus coming in this mnemonic. So definitely these two are not answers. Answer will be from these two, right? Now both of these are not coming in this mnemonic. Of course, I can understand. But Cryptococcus is not a bacteria. You know, Cryptococcus is a fungus. Cryptococcus is a fungus, and in fungus you may have remembered I taught you it is a capsulated fungus. So this also have capsule, but it is not coming in the mnemonic because this mnemonic is for bacteria. Right, I told you 9 bacteria is here, but among fungus this one is also capsulated. Right, Proteus is a bacteria which is not capsulated, so I will go with D. So question is little bit tricky, not very much but a little bit tricky. It is your PYQ. Everyone give me a thumbs up. Correct answer is not B. Correct answer here is D. I am repeating. Answer here is D. So all those who have marked B, have you realized why you are wrong? Have you realized? Cryptococcus is not coming in this mnemonic. I agree. I agree. Still it is not the answer. Because this mnemonic is of bacteria, you know, and Cryptococcus is a fungus which is capsulated. One of the capsulated fungus. Give me a thumbs up. Come on. So examiner will try to confuse you, right? But you don't have to fall in the trap. We shall go ahead. So this is the mnemonic. Correct answer here is Proteus D. Right? Okay. Moving to the next mnemonic. Now how many bacteria are motile? What do you mean by motility? Motile. Motile means movement. Yeah, right. Humans have legs, no? We all have legs. We can move from here to there. Of course, we all can move because we have these 2 legs. We can move from here to there. So in the same way, let me draw a bacteria. Does bacteria move from here and there? Not all, not all. Only the bacteria which have flagella. The flagella is like the leg of humans. You know, it's flagella. Flagella. Only the bacteria which have flagella, they can move. So flagella is the organ of locomotion. It's a MCQ. You should learn. Flagella is the organ of locomotion in bacteria like legs in human. Okay. So how many bacteria have flagella? There are 12 bacteria which have flagella in the world. You should know the 12 names which can move. Otherwise, not all bacteria move. Only 12 can move because they have flagella. So before telling you those 12 names, you should know the types of flagella. There are 2 types of flagella you must understand. Can you see the 4 bacteria I have drawn in front of you? Can you see only one flagella? This is only one flagella. So it is known as monotrichous. Only one flagella at one end. Here one flagella at one pole, one flagella at one pole. North pole, south pole. So 2 flagellas are there. It is known as amphitrichous. The third one, multiple flagella. 3, 4, 5 flagellas are there, but all are from one of the pole. Either north pole or south pole. It is known as lophotrichous. It is the tuft of flagella, multiple flagella. And here you can see flagella all around, not from the pole. Right, right. Listen my point. My point is that these 3 have flagella at pole. That's why known as polar flagella. North pole, south pole. And this one flagella all around, not at the pole. So this one is known as Parry. Parry. Parry means everywhere. Parrytrichous. So flagella are of 2 types. Polar and Parrytrichous. Polar further of 3 types. Mono, amphi and lopho. You got my point? So there are 2 types of flagella. What are the 2 types of flagella? One is polar, where flagella present at the pole. And one is Parrytrichous, where flagella present everywhere. Right? So let me draw a bacteria. It is of 3 types. So let me draw 3 bacteria. 1, 2, 3. This is only of one type. Right? So let me finish Parrytrichous. It's everywhere. Right? Everywhere. And let me come on the pole. One at the pole, multiple at the pole, and one at both pole. So it can be mono, it can be lopho, and it can be amphi. Now these are the 3 subtypes of polar, but don't worry. Listen, what is my point? There are 6 bacteria which have polar flagella, and there are 6 bacteria which have Parrytrichous flagella. So in this way, total 12 bacteria are motile. Everyone give me a thumbs up. Everyone. Yes, so 12 bacteria. So I'm going to give you 2 mnemonics, right? One mnemonic having 6 bacteria with polar flagella, one mnemonic having 6 bacteria with Parrytrichous. So 6 plus 6 is equal to 12 bacteria are motile. So in your exam, your concept should be crystal. Your question will be like that. Which of the following bacteria is motile by polar flagella? Which of the following bacteria is motile by Parrytrachus flagella? You know, so you should be specific कि polar से कितने घूमते हैं और Parrytrachus से कितने move करते हैं, right? So 2 mnemonics. You got my point? Okay. The 2 mnemonics are in front of you. I guess they are in front of you. The 2 mnemonics. Let me tell you. So let me first talk about Parrytrachus. Everywhere. Flagella is everywhere. ठीक है? Cute, baby, sleep. Sleep में एक ही E है. SLEP, not double EP. So cute का C stands for Clostridia. All Clostridia except Perfringens and Titini. Right? Baby का B stands for Bacillus. All Bacillus except the main Bacillus, Bacillus anthrax. S stands for Salmonella. All Salmonella except Gallorum polorum. You can leave the exception, not very important. Salmonella. L stands for Listeria. E for E. coli. And P for Proteus. Count, they are 6 in number. Cute, baby, SLEP, sleep. Give me a thumbs up, come on. Give me a thumbs up. You got my point. Now see, these are the Parrytrachus flagella. Now here I am coming polar. The 6 are motile by polar. So what is the mnemonic? Very protective solution, HCl. Or you can make very polar solution. HCl is hydrochloric acid, na? So very ka V stands for Vibrio. Protective ka P stands for Pseudomonas. Solution का S stands for spirochetes. H Helicobacter pylori. C Campylobacter. दोनों भाई भाई. Helicobacter, Campylobacter. Both are together, right? And L stands for Legionella. L stands for Legionella. Count. They are 6. They are 6. Now don't ask me, ma'am, in sub में से which of them are monotrichous, which of them are lophotrichous, which of them are. And frankly speaking, even I don't know. Knowing that they are polar, it's more than sufficient. Don't subclassify them. Give me a thumbs up. Give me a thumbs up. So can you tell me the name of the 12 bacteria which have flagella? How many have Parrytrachus flagella and how many have polar flagella? Can you help me with that? Can you please? So Parrytrachus flagella. Cute, baby, sleep. SLEP. Only one E, not double E. Cute, baby, sleep. Say the full form. It's more important. Coming on polar. Very polar solution. Very polar solution. HCl, hydrochloric acid. Now say the full form. I can say the full form, but it will take time. So try to say by yourself later on to your friends and help everyone in spreading this knowledge. Right? So the more you say, the more you will learn. So try to see the full form and now see the questions based on that. Now it's a complicated mnemonic, but you know, learning mnemonic is very easy. Learning the full form of mnemonic is difficult. So you have to learn the full form of the mnemonic. You got my point? Yes, cute baby sleep. And very protective solution HCl. So total 12 bacteria in this way, they are motile. One more thing, as I have told you, humans have leg. So we all move, of course, right? So in the same way, bacteria have flagella. These are the legs, right? We all move. Of course, I also move, you also move, everyone moves. लेकिन सबकी चाल अलग-अलग होती है ना चलने की. कोई बल खा के चलता है, कोई लहरा के, कोई कैसे, कोई भागते हुए, कोई slow. So in the same way, all the 12 bacteria which have flagella, they move, but they have different types of motility. Motility मतलब उनकी चाल अलग-अलग है. You got my point, right? So see, इस पे भी बहुत MCQ आता है. So darting is Vibrio cholerae. Tumbling, you know, tumbling is Listeria. Stately is Clostridia. Corkscrew, the bacteria in the form of the screw. It moves in the form of the screw. It's Trypanosoma pallidum, right? Gliding means sliding. It's like sliding. Mycoplasma. In सब पे तो ज़्यादा MCQ नहीं आते हैं. The most MCQ in the previous year question paper is swarming. Swarming means in the form of the circles. The bacteria move in the form of the circle. It is swarming. So you have to learn the name of the 4 bacteria which show swarming. The 2 Proteus, Proteus mirabilis, Proteus vulgaris. Proteus mirabilis, Proteus vulgaris, the 2 Proteus. 1 Clostridium, Clostridium tetani, and 1 Bacillus, Bacillus cereus. These 4 show swarming and many PYQs are based on this. But you never know on other motility if PYQs are coming. Maybe question coming this year. But till now I have seen PYQ on swarming multiple times. Give me a thumbs up. Give me a thumbs up. Right? Okay, so we will solve some questions based on motility. Motility pe we have seen 6 bacteria which show Parrytrachus, 6 bacteria which show polar. So total 12 bacteria we know, and after that we know the various types of motility in which the most important is swarming. Right? Okay. Can you help me in solving these questions now? We will solve 2-3 questions. Can you help me? Parrytrachus flagella is seen in. Can you tell me the mnemonic for Parrytrachus first? Can you tell me the mnemonic for Parrytrachus? So yes, it's cute, baby, Sleep. S-L-E-P. Sleep. Now apply the mnemonic. I have written the mnemonic. Can you apply? Huh? Can you apply? Yes? So, what is the correct answer? Who will tell me the correct answer? Cute baby sleep is the mnemonic, na? I guess Vibrio is not coming in this mnemonic. Vibrio is coming in very protective solution HCl. So answer is A. Why you are saying B and D? Okay, it's coming. I thought the question is accept. I'm sorry. Yes. So Vibrio is not there in this mnemonic. I can see there is no Vibrio, of course, right? Campylobacter is also not coming. The second mnemonic, very protective solution, HCl. So Vibrio is coming in that mnemonic. Campylobacter also coming in that mnemonic. Not here, right? Not here. What about Proteus and Legionella? Which is coming in this mnemonic? What is the correct answer? Is it Proteus or is it, because P is coming in both of them. One is Proteus, one is Pseudomonas. So correct answer is B, of course, you all are right. It's Proteus. So Proteus is coming in this mnemonic and L. Legionella is coming in the other one. So if you don't know the segregation now, which of them are Parrytracheus, which of them are polar, you will get confused. They all are motile. All four are motile. But they are not asking motile. They are asking the Parrytracheus flagella. So you should be specific for your answer. The correct answer here is B. If you know the mnemonic, the full form, it will be easy for you to crack. Give me a thumbs up, everyone. You got it? If you got it, give me a thumbs up. Can we move ahead? Okay, the next question in front of you. Which among the following is non-motile? Absolutely non-motile. They are not asking the polar, the Parrytracheus. They are asking not motile. So write both mnemonic. Cute, baby, sleep. These six are motile by Parrytracheus flagella. Very protective solution HCl. These six are motile by polar flagella. So these 12 are motile, and except these 12, every one is non-motile. So can you help me in answering? Yes. So Shigella is coming nowhere. Of course, not here, not here. So the correct answer here is Shigella. E. coli, it's coming here. Proteus, it's coming here. Vibrio, it's coming here. Somewhere it's coming. But Shigella is coming nowhere. I guess the correct answer is A, and you all are right. Give me a thumbs up. So this is how the utility of the mnemonics you can see, right? Coming on the next question, again a PYQ in your exam. So we will solve all the PYQs, right? Maximum based on the mnemonics. So swarming motility is seen in. No, swarming means circles. The bacteria moving in the circles on a culture plate, the rapid motility. So I told you the name of the 4 bacteria which show swarming. Just now I told you 2 were Proteus. Proteus vulgaris, Proteus mirabilis. 1 is Bacillus, not anthrax, it's Bacillus cereus. And the 4th one is Clostridium. But which Clostridium? That is our question. Which of the Clostridium shows swarming motility? Yes, it's Titani. I told you clearly it's Titani. So correct answer here is A. The remaining Clostridium do not show swarming. Right? So this one is very fast motility. That's why move in circles. Give me a thumbs up. Come on. Can we go ahead? Can we? Okay. So the correct answer here is A, and you all are right. Coming on the next mnemonic. How many bacteria produce spore? Only 4. गिनती के 4 बैक्टीरिया हैं दुनिया में जो स्पोर बनाते हैं. बाकी कोई स्पोर नहीं बनाता. No other bacteria form spore except these 4. So you should know these 4 names. Yes or no? So yes. So the mnemonic is BSc chemistry. BSc chemistry. 2 C's are there, right? So B stands for Bacillus. All Bacillus. Whether anthrax, subtilis, Bacillus, right? S stands for Sporosarcina. It's a name of bacteria. I guess you have not heard it. It's a rare bacteria. I usually don't teach in bacteriology. But yeah, नाम में ही है sporo. तो उसमें spore होते हैं. It's Sporosarcina, right? 1 C stands for Clostridia and another C stands for Coxiella burnetii. So only 4 bacteria in this world form the spores. Can you tell me the mnemonic? BSc chemistry. BSc chemistry. So BSc chemistry, spore, related to the spore forming bacteria. BSc chemistry is spore forming bacteria. B stands for Bacillus, all Bacillus. S for Sporosarcina. C for Clostridium, all Clostridium, no exception, all of them, right? And another C is Coxiella burnetii. Coxiella burnetii, right? Coxiella burnetii पे एक और MCQ आता है. One more MCQ comes from this bacteria. If this naming is coming now, I just remembering it. This is one of the bacteria which is not killed in pasteurization of milk. So answer is Coxiella burnetii, right? Pasteurization of milk is a way of sterilizing the milk. When we pasteurize the milk now, all the bacteria are killed except Coxiella burnetii. It is also an MCQ. Give me a thumbs up, right? So these are the 4. Can you see the spores? These are the spore forming bacteria. There are 6 types of spores. The 6 diagrams are in front of you. You know the classification of spores. Okay, let me tell you. It's very easy. Spores are either circular, Can you see? Circular, 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 or oval, 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 oval. So based on the shape, either circular or oval, right? You can see like that, right? The second thing is that the main is whether they are bulging or not bulging. Can you see? This is bacteria inside which the spore is present. So it's not bulging. It's not bulging out. It's not bulging. It's not bulging. But here you can see spore is big, so it's bulging out. So this one is bulging, this one is bulging, and this one is also bulging. So whether it's non-bulging, bulging, right? The third is its location. So this is in center, central, central. This is subterminal, subterminal, and this is terminal, terminal, right? So let me tell you the 6 type of the spores. These 3 are bulging, na? So bulging, bulging, and non-bulging. First write that, right? Bulging maybe there are 3 types, central, subterminal, terminal, and non-bulging may also 3 types, central, subterminal, and terminal. Forget about the shape, not important. So these are the 6 type of the spores, right? Right. Yes, PDF I can provide you. I can provide to the team and they will provide you, right? Okay. So spore forming bacteria, it's BSc chemistry. Don't forget BSc chemistry, right? So these are the types of the spores we have learned. Can you solve this PYQ with me based on this concept? I guess you can. All of the following are spore forming bacteria except, the question contains except. Who will tell me the correct answer? Who will tell me the correct answer? Just a second. Okay. Okay. Yes, you all are right. The correct answer here is D. Apply the mnemonic now. BSc chemistry. So I guess all Clostridia. So Clostridium is coming here and all Bacillus. So both Bacillus are also coming. But Vibrio is no way coming in this mnemonic. So correct answer is D and you all are right. Very good. Very good. So coming on the next concept. You know, based on oxygen requirement, there are 6 types of bacteria. How much oxygen, which bacteria is required? Right. You have to understand the meaning of the term obligate. Obligate means compulsory, compulsory. So there are obligate aerobe and obligate anaerobe, means compulsory. Obligate aerobe are the bacteria, they compulsorily require oxygen, without which they will die. If you don't give oxygen, they will die. They will die. And obligate anaerobe are the bacteria which compulsorily do not require oxygen. They grow in absence of oxygen. If you give them oxygen, they will die. They will die. So these 2 are obligate one. Obligate means compulsorily, right? They are compulsory. The second type are facultative. Facultative means adjustive. They can adjust. They can adjust. The facultative. Facultative anaerobe. Anaerobe means actually they are aerobes. They prefer aerobic. But if you give anaerobe, so they will adjust in aerobic also. They will not die. And facultative aerobes are actually anaerobes, but they can adjust in aerobic environment also. So these 2 are facultative. 2 are obligate, 2 are facultative. You got it? One is microaerophilic. Microaerophilic means they require small amount of oxygen, not much. That is microaerophilic. Now, can you classify the bacteria based on that? How many classifications shall I tell you? So I will give you some mnemonics. First, let me give you mnemonic for obligate anaerobe. जिस पे बहुत MCQ आता है. Obligate means compulsory. They are compulsorily anaerobe means they do not require oxygen. They grow in absence of oxygen because they are anaerobic, compulsorily. If you give them oxygen, they will die. They will die. So only 3 bacteria are there. So the mnemonic is can't breathe air. They are compulsorily anaerobe. They can't breathe air. If they breathe air, they will die. They will die. So C stands for Clostridia, B stands for bacteroids, and A stands for actinomycetes. Give me a thumbs up. Can't breathe air. These are the 3 bacteria. Naam mein hi hai, mnemonic. By mnemonic you can understand because they can't breathe air. They are compulsorily anaerobic. That is obligate anaerobic. So can't breathe air. Please learn the full form. Right. And tell me the names of the aerobic bacteria. So aerobic bacteria are many. So there is a mnemonic for that also. The mnemonic is B3. Triple B. B3. KLMN. In ABCD alphabets there is KLMN. OP. But there is no O triple P. KLMN. Blank O and P, and in the end we have V. Let me write B3, K, L, M, N, no O, then triple P and V. So this is the mnemonic. The best I can compile that also. So there are 3 B's, you know. So Bacillus anthrax, Bordetella brucella. The 3B, right? K say Klebsiella, L say Listeria, M say Mycobacteria, tuberculosis also, leprosy also, and N say Nocardia. Ansinocardia. Triple P. There is triple P. Pseudomonas, Proteus, Pasteurella. Right? N भी दो हैं. There are two N, Neisseria and Nocardia. And V से Vibrio. Give me a thumbs up. So let me tell you the two mnemonics together. Obligate anaerobic bacteria and aerobic. Aerobic I am considering both, facultative as well as obligative. I am not saying only one. Right? Can you tell me the mnemonics? Can you tell me the mnemonics? Obligate anaerobic bacteria can't breathe air. They can't breathe air. And aerobic, tell me the mnemonic. It's B3 KLMNO. There is no O, but triple P. 2N and triple P. And in the end, it's V. It's V. Right? So you can try saying the full forms based on this. You will not get direct question which of the following bacteria is obligate, anaerobe, obligate. No, it will not be as easy question. But you will get big clinical questions. Now you will get clues. So one of the obligate anaerobic bacteria is doing infection or grown on the culture plate. So you will get differentials or clues in your questions based on this mnemonic. Give me a thumbs up. You're getting it? Yes. So based on oxygen, one more. I have told you after that microaerophilic also, no? Microaerophilic, they are not aerobic, they are not anaerobic. ये बीच के हैं उन दोनों के. They require oxygen, but in small amount. Like aerobes, they do not require much oxygen. Like anaerobes, they do not require absence of oxygen. They require also, but in small amount. So ये aerobe and anaerobe की there is something intermediate category you can say. So how many bacteria are coming in this category? Only 3. You should know the mnemonic. Only 3. So Hellboy camp. Hellboy in microcamp, this is the mnemonic, or you can make some other mnemonic. Hell is Helicobacter. Boy is Borrelia. And camp is Campylobacter. Hellboy camp. So let me summarize once again. Based on oxygen, we are done. We are done. So based on oxygen, we divide the bacteria into 3 categories. Anaerobic, which are obligate anaerobic. Aerobic. Aerobic and microaerophilic, which are the intermediate between these two. Right? So anaerobic are only 3. Can't breathe air. Microaerophilic again 3. Hell, boy, camp. You know the full form. But aerobic, they are many. They are many. You should know the mnemonic. It's B3 KLMN. O ko bana do V and P. KLMNOP. You can learn like that. Give me a thumbs up. Come on. Can you solve the question? Can you solve the question? Alicia, that you have to confirm with the NLC team. I guess after live session, I guess it should be available, but I am not very much aware about that. You should contact NLC team for that. Right? Anyways, let me go ahead. Which of the following is microaerophilic? Can you solve this question now? Apply the mnemonic. Just now I told you only 3 bacteria are there, which are microaerophilic. What is the correct answer? Lakshmi, Mohit, Alicia, Trust, Anand, Ajay. Many students are there. What is the correct answer? So the mnemonic is hell, boy, camp. Can you apply? Yes. So the correct answer, camp, is Campylobacter. Yes, yes. So the correct answer becomes here. The correct answer becomes A. Very good, very good. Not D, it's A. Right? Apply the mnemonic, no? Everyone is right, everyone. Now I'm changing the question. In the same question, I'm changing. Which of the following bacteria is obligate anaerobic? What is the answer now? Can you apply the second mnemonic, other mnemonic? So I told you can't breathe air. Now apply the mnemonic. B for what? B for bacteroids. Your answer will become C. Yes, in the same question. So whatever is the question, if your concepts are strong, now you can rock it. You can hit it. Can we go ahead? Can we go ahead? Yes, we must. So now I am giving you 3 mnemonics for the biochemical reactions. You know, there are some bacteria which are catalase positive. There are some bacteria which are oxidase positive, and there are some bacteria which are urease positive. These are the 3 important biochemical reactions which differentiate the bacteria. Now students always have confusion. There can be direct question, and again there can be a clue or link. There can be clue in a big questions. A catalase positive bacteria, oxidase positive, urease positive. So you should have differential in your mind what they are talking about. There are only 4 bacteria which are catalase positive. There are only 7 bacteria which are oxidase positive, and I guess 7 or 8 bacteria which are urease positive. So I'm going to give you 3 mnemonics for this. Right? So we will revise again after saying the mnemonics. Let me start with catalase. The 4 bacteria which are catalase positive, the mnemonic is SSVE, 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 VE, CIVI, SSVE. So double S, Shigella and Staphylococcus. Staphylococcus are catalase positive. Another as is not Streptococcus. You know, Staphylococcus and Streptococcus. We know both of them are gram-positive cocci. The only difference between them, this one is catalase positive and this one is catalase negative. So Staphylococcus are catalase positive but not Streptococcus. This is the way we differentiate them. So here in this mnemonic, Staphylococcus is coming but Streptococcus is not coming. Another S is not Streptococcus, it's Shigella. It's Shigella. There are two S, Staphylococcus and Shigella, not Streptococcus. V is Vibrio and E is all Enterobacteria. There are many Enterobacteria, no? Klebsiella, Salmonella, you know, so all of them, the all type of Enterobacteriaceae. So SSVE, the 4 bacteria which are catalase positive, give me a thumbs up. Give me a thumbs up. Can we move ahead? Can we move ahead? Oxidase positive. How many bacteria are oxidase positive? There are only 7 bacteria which are oxidase positive. So what is the mnemonic? He loves painting very nice picture building, on building. So he loves painting very nice picture on building. So H stands for H. pylori, L for Legionella, P for Pseudomonas, V for Vibrio, N for Neisseria, P for Posturella and B for Brucella. I know learning the mnemonics is difficult, but at least if you know the mnemonic, there is a chance you can hit the question. Even if you don't know the mnemonic, there is no chance you will do it correctly. फिर तो तुक्का और भगवान मालिक है, right? So at least उससे तो better है ना. You apply the mnemonic and try your luck and the mnemonic, right? So mnemonics are useful. Try to learn them and revise them few days before your exam. You have much time now. You can revise all the mnemonics before your exam. Right, you can write all the mnemonics at one place. In 2-3 pages, just compile them and revise those 2-3 pages before going to your exam. Right, so that is the oxidase positive, the 7 bacteria. Coming on urease positive. How many bacteria are urease positive? So the mnemonic is KP Saxena ki CD ultimate hai. Right, so it's K se Klebsiella, P se Proteus, KP Saxena ka S is Staph aureus. Staph aureus was catalase positive also and urease positive also. Staphylococcus. CD. C stands for Cryptococcus and D stands for diphtheroids. ठीक है? Ultimate का U stands for ureoplasma. And H, there are 2 H. H. pylori and here it is not written. It's H. influenzae. यहाँ गलती से नीचे आ गया है. H. influenzae. या H, हाँ, H. influenzae. ठीक है? So this is the mnemonic, right? So it's 1, 2, 3, 4, 5, 6, 7, 8. 8 are there. So can you help me with the 3 mnemonics? Catalase positive, oxidase positive and urease positive. Can you help me? Okay. There are 4, they are 7 and they are 8. Anyone among the audience? Please try. So yes, very good. Manisha, it's SSVE. Very good. It's SSVE. Right? Try to see the full form. Oxidase positive. He loves painting. See, he loves painting. Very nice picture. He loves painting. Very nice picture building. On building. So don't say on. You will get confused. He loves painting. Very nice picture. Very nice picture building. Learn like this. Right. Coming on urease positive. KP Saxena. KP Saxena. CD. Ultimate hai. Say 2 times hai. So you will remember there are 2 H. One is H. influenzae and one is H. pylori. So KP Saxena CD ultimate hai. Right? Learn like that. Or H2. Right? Give me a thumbs up. Come on. I tried hard. Yes. Very good. Right? Yes. Very good. So try to say the full forms and you will get many clues in your question based on these 3 mnemonic. Try it out. The big clinical questions. They will become super simple for you. Right? Coming on the next mnemonic. The next mnemonic, okay. The next mnemonic, Hackett group of organism. You know what is Hackett group of organism? These are the 5 bacteria. HACEK. 5 bacteria. They all are gram-negative bacteria. None of them is gram-positive. They all reside in the oral cavity of humans and they all causes endocarditis. They all can cause endocarditis if they got entering the bloodstream. From the blood, they go in the heart. In the heart, they go on the walls of the heart and causes vegetations on the heart walls. And they cause infective endocarditis, right? So this group is known as Hackett group of organism. Can you tell me the full form of Hackett? There is a direct question in the PYQs. Hackett में C stands for what? E stands for what? K for what? Right? So H for Haemophilus. H for Haemophilus. A for Actinobacillus. C stands for Cardiobacterium. E for Incanella and K for Kingella. It's not E. coli, it's not Klebsiella, Inkinilla and Kingilla. Can we move ahead? It's Hackett group. I guess everyone knows it, right? Now, in between the mnemonics, there are some lists also. So I have put all those important lists also in this PPT. Later on, I can share the notes, right? Now, these all are skin tests. These two everyone knows. If I ask you how many skin tests in microbiology, you know, you will say two names. Lipramin test for leprosy, ma'am, and tuberculin for TB. But MCQ don't come on this, frankly. They are very easy MCQ, it don't come in your exam. But Fry test is also a skin test. And it is done for chlamydia. Do you know that? It's your PYQ, right? Kivian test is also a skin test. It is done for sarcoidosis. It's also your PYQ, right? Fairley's test is also a skin test. It is done for one of the parasite. The name of the parasite is schistosomiasis. Cassoni test. The spelling is wrong. There is a typing mistake. It's Cassoni. Cassoni test is also a skin test. And it is also done for a parasite hereditary disease. That is Echinococcus granulosus. Right? And Sheik test is also a skin test. It is done for a bacteria, diphtheria. So I guess these all are skin tests done for diagnosis of some bacteria or parasites. Right? So you know only two, I guess, most of the students, but others also, they all are PYQ. Now I'm not wasting my time putting the PYQs on these. They will be one-liner. So Fry's test is for chlamydia, Kivim test is for sarcoidosis, Fairley's test for schistosomiasis, Cassoni pe multiple time question hai, don't miss it. Cassoni is for hydatid cyst and Sheik pe bhi multiple time question hai. Sheik is for diphtheria. Yes, give me a thumbs up. Yes, it's dog tapeworm, Manisha. Absolutely right. Dog tapeworm is hereditary disease. Echinococcus granulosus. Can we move ahead? These all are skin tests at one place. So complete microbiology mein, these are the skin tests. You must know. You must know. Now, okay, this is the blood vessel of human. And inside the blood vessel, we have three types of cells. We have RBCs. We have various types of WBCs. We have neutrophil, eosinophil, basophil, lymphocyte, monocyte. These all are WBCs, right? And apart from which we have platelets. The three types of blood cells, RBC, the various types of WBC, the 5 types of WBC basically, and the platelets, right? Now, if any bacteria got entry in the human blood, where is the bacteria? Where shall I draw it? So this is the bacteria. So most of the bacteria remain in the plasma. They remain in the blood. But some bacteria prefer to go inside the cell. They are known as intracellular organism. Bacteria, they prefer to go inside the cell and remain viable only inside the cell. They cannot remain viable outside the cell. These are known as intracellular organism, right? So let me give you the list of intracellular bacteria. Do you know such list? How many bacteria they prefer to grow intracellularly and in which cell? So let me tell you the name of the bacteria which reside inside only RBC. Let me tell you the name of the bacteria which reside inside neutrophil. Let me tell you the name of the bacteria which reside inside monocyte, right? So here is a list in front of you. It's very simple, very easy. Neutrophils. Inside the neutrophil, there are three bacteria which reside inside neutrophil. One is Leishmania. Leishmania is not a bacteria, it's parasite. One is Mycobacterium, it's a bacteria, and gonorrhea. So two bacteria and one parasite. They remain inside neutrophil. They prefer to grow inside neutrophil, right? They are intracellular. लेकिन intracellular में भी कौन सा cell, to be specific? Intracellular में कौन सा cell? It's neutrophil, right? It is one of the WBC. मोनोसाइट इट्स ऑल्सो WBC, लेकिन नॉट न्यूट्रोफिल, इट्स मोनोसाइट. मोनोसाइट के अंदर लिस्टेरिया रहता है. लिस्टेरिया ग्रोज इन मोनोसाइट ओनली. ठीक है. RBC इट्स ऑल्सो ब्लड सेल, बट RBC के अंदर मलेरिया, प्लाज्मोडियम and babesia. They remain inside RBC, right? Overall, any WBC, no specificity. कोई भी WBC चल जाएगा. Neutrophil, eosinophil, basophil, lymphocyte, monocyte. So trypanosoma remain inside WBC, non-specific. And last, macrophages के अंदर histoplasma. Everyone give me a thumbs up. I tried hard. So you can imagine, you can get specific questions based on that. Either direct question or a clue in big question. So you should be prepared for all. Right. So there is an intracellular microorganism. So you should know your answer will be one of them. If it is one of the line in your big question, there is an intracellular microorganism. And if they mention the cell, your answer will become more specific towards that line. Give me a thumbs up. Are you getting it? Are you getting it? So please learn all these lists and don't try to mug up, just read it. Casually read it twice or thrice before your exam. It's not a subjective exam. You don't have to do the essay writing in your exam. Of course, one of the 4 options you have to just pick. The answer is in front of your eyes. Only your eyes should be identify the correct answer. Your brain should be identifying the correct answer. So don't try to mug all the list. It will be tedious for you. Just read them casually. And human brain have enormous memory. Even if you remember, even I feel कि मैं सब भूल जाऊंगी एग्जाम से 1 day before. Everyone have this feeling. It is normal having this feeling. Many students text me, ma'am, I'm feeling. 1 day before exam, they text me, ma'am, I'm feeling I have forgotten everything, what to do now. So even I have this feeling till date, right? So it's a human tendency, it's a psychology. We have fear from inside and we feel that we have forgotten everything. But no, it's only feeling. Actually, everything is reserved inside the brain. And once you go in your exam, take proper sleep, take proper rest, calm down. And once you go in your exam, once you see the 4 options, now it will click to your mind that, yeah, this is the correct answer. Even if you don't know the complete list now, it will click. No, I think the अंदर से ऐसा gut feeling आ रहा है कि ये है. वो gut feeling नहीं होता है, वो कहीं ना कहीं तुमने पढ़ा हुआ होता है पीछे. कहते हैं ना gut feeling आ रहा है, नहीं ये सही है, I don't know the reason, लेकिन ये सही है और वो सही होता भी है. But actually you have gone through somewhere in the list. So your brain is capturing that. So can I move ahead now? Yes, yes, it's the footer memory, you can say. Let me move ahead. How many bacteria produce pigment? They produce colored colonies, the pigments. Yes, so only 4 bacteria. They produce pigments and colored colonies. So the first one is the Staph aureus. They produce yellow pigment. That's why it's oil paint appearance. Have you heard about it? It's your PYQ. Oil paint appearance colony is formed by Staph aureus because it produces yellow pigment. Yellow pigment. The second is the Pseudomonas. Pseudomonas aeruginosa. It produces blue-green colonies. The beautiful blue-green, if you have seen in your laboratory, right? The third is Actinomycetes Israeli, right? It produces yellow sulfur granules. Sulfur granular. It's also yellow, but a granular dot. It's very smooth yellow, like oil paint. And this yellow is very granular, right? It's dot like that. And the last one is Serratia. It produces red color colonies, the blood red color. So the 4 colors are different, the 4 bacteria are different, right? So you can get a clue or direct question. I don't know what you will get. But you should know this list. This list is ultimately important in somewhere in cracking the questions of microbiology. Can we move ahead? Can we move ahead? Is this session you are finding, is it useful for you, for your exams, upcoming exams? So yes, each and every slide is useful for your exam and you must revise before your exam. Okay? So we should move ahead. Okay. Let's move ahead. Here I am giving you a list. I will not read this list. I will provide the PDF if you wish. The culture media, the important culture media. Now there are more than 40-50 bacteria in your syllabus. I have taught you all of them in your complete course, if you remember, right? But it's not time to revise it completely. So at least you should revise the important culture media of all the bacteria. There are high chances you will get 1 or 2 questions on the culture media in microbiology, right? Just for example, you will get MYPA media is for which bacteria? So answer is Bacillus cereus. Boarded gangu medium is for which bacteria? It's for Bordetella. Like it's only important. Screw medium, it's a PYQ. It's for H. pylori, right? In the same way, you can see the list, right? Citramide agar pe multiple time PYQ hai. It's for Pseudomonas. You may have solved your PYQs, I guess, till this time. BCYE medium is for Legionella. These all are your PYQs. Loeffler's serum slope. Telluride agar, Tinsdale agar, it's for Corynebacterium. Robertson cooked meat agar, RCM. Robertson cooked meat agar, it's for Clostridia. It's the anaerobic medium, right? Smith-Nagauchi. This one is not FMG but NEET PG PYQ. Smith-Nagauchi is for spirochetes, right? DCA, deoxycholate agar, it's for Shigella. Ludlam's is for Staphylococcus. These all are your PYQs. Now there are 2 options. Either solve PYQs one by one or to compile the list at one place and revise that list. I guess this method is more useful. You just revise this list. You will get 1 question definitely from this list. I am saying the paper is out, right? You will definitely get 1 question from this list. So ghee broth pe bhi bahut question hai. Have you solved your PYQs? It's Posturella or Yersinia. Right, so you should solve. Yes, TCBS is for Vibrio. Wilson Blair is for Salmonella. These all are your PYQs. Yes, I will provide you the PDF. Don't worry. Give me a thumbs up if you got it. Can we move ahead? Give me a thumbs up. Can we move ahead? Yes, okay. This one more list, the last list I would like to add here, the important colony appearance. Now, if you take a culture media, this is a culture media, and try to grow the colonies of bacteria on this culture media, so colonies will be grown like this, right? But the colonies are generally usually same, but there is some peculiar colonies of some bacteria. You should know that list. Jo peculiar hai, jo exception hai, the question will be on that. For example, oil paint appearance repeated multiple times in your PYQs. I'm sorry. Oil paint appearances by Staphylococcus aureus. right? You know what's Draughtsman? Draughtsman is carom coin. In the colony, in the center there is a hole. Have you played carom board? The coin of the carom board. हिंदी में कहूँ तो carom board की गोटी. Carom board की गोटी में center में एक depression होता है. In the same way, the colony have a central ambonation or central depression. It's known as Draughtsman appearance. It's seen in Pneumococcus, right? Fried egg colony. Have you seen fried egg? Fried egg में outer is white and inner is yellow. The fried egg, right? So the colony of mycoplasma is like fried egg, right? Have you seen thumbprint? If I put my thumbprint somewhere, so can you see the thumbprint line? The colony is like this. So it's looking like the thumbprint. So thumbprint appearance is Bordetella. The aluminium print or thumbprint or mercury drop. These all are your PYQs. I'm saying that. You know the checkerboard. What do you mean by checkerboard? The colony is like this. Checkerboard appearance. The checkerboard colony is Streptococcus pneumoniae on blood agar. Right. So you should have an imagination in your mind. IBQs will not come on this, but yeah, you should have an imagination. Checkerboard means, carom coin means, thumbprint means, oil paint means. So you will have a better learning. Give me a thumbs up. Give me a thumbs up. Daisy head. You know what is daisy? Daisy is a flower like sunflower. It's a flower. So the colony will be like this. It's looking like a flower. It's the daisy head like a flower, right? It's Corynebacterium diphtheria. Corynebacterium diphtheria. Medusa head. What do you mean by Medusa? Medusa is a girl with a curly hairs, right? Medusa head, the head of Medusa, right? So the colony will be like this, the curly hairs of a girl like Medusa. So it's Medusa head. So these are the names given, specific names given to the colony appearance of some particular bacteria, and you can't believe me, these all are your PYQs. If you solve your last 5-year PYQs now, 5 year means 10 papers every 6 months, right? In the 10 years, you will get all these. Somewhere you will get all these. Give me a thumbs up. Those who have already solved the PYQs, they know what I am talking about. So learn all the appearance at one place. Now 2 things I have left here to highlight. One is satellite colony. Okay. This one. Give me a minute. Satellite. And one is stelactic. Both are different. See, now both are starting from S. Both are your PYQs to confuse you, right? Satellite colony and stelactic colony, both are different. Satellite is seen in H. influenzae and stelactic colony is seen in Yersinia pestis. Don't get confused. Satellite and stelactic are different. That's why I have highlighted them with a different color. See, both are PYQs. Again, I am repeating. Give me a thumbs up. Can we move ahead? Okay. So one more list. Bacteria with their alternate names. Alternate names is the name of the scientist who has discovered that bacteria. Some questions come on that only. For example, till now I have seen question on this, on this, and on this. These 4 are your PYQs, not the complete. So you know who is Clapp Loeffler bacilli? The bacteria which is discovered by Clapp and Loeffler, the 2 scientists. The answer is Corynebacterium diphtheria. Do you know Friedlander bacilli? It's Klebsiella pneumoniae. Do you know Fresh bacilli? It's Klebsiella rhino. Both are Klebsiella, but they are different. And Koch's bacilli, everyone knows. Everyone knows it's TB. It's TB. So you should know this list. Right? Okay, let me move ahead. Okay. After this, the next high yielding topic here, I will come on mnemonics again. Let me finish the bacteriology. Now I will start parasitology and again with the mnemonics, right? This list about staining in the bacteria. You know the 2 main stains in the bacteria, the Gram stain and acid-fast stain. You know it? You know the 4 steps? The 4 steps in each of them? So in Gram stain, the main primary stain is a violet color. Right, but in acid-fast stain, the primary stain is red color. Here it's violet color, here it's red color. Can you see? Then there is a mordant. Here mordant is iodine and here mordant is heat. Compare. Then decolorizer. Here decolorizer is acetone or alcohol, ethanol. And here decolorizer is 20% sulfuric acid. See how I have put it comparatively. Comparatively you have to learn. And secondary stain here is red color. And here it is blue color. So primary and secondary stains are ulta pulta, you know, in each of them. So here primary is blue, secondary is red, here primary is red and secondary is blue. Give me a thumbs up. At the end we have Gram positive, Gram negative, right? And at the end here we have acid fast organism and non-acid fast organism. Everyone give me a thumbs up. Come on. You know the 4 steps? Gram stain and acid fast stain. Can you tell me the primary stain in both of them? In Gram stain, it's a violet stain. Any violet stain. Crystal violet, you know, many violet stain, any. But here it can be a red stain. You may be knowing the names of the stain, I guess. Red stain is carbol fuchsin, saffronin. Here violet stain is crystal violet, right? So any violet stain is there. After that there is mordant. Here mordant is iodine. Here mordant is heat. That is fixing the primary stain. Then after that we have decolorizer. Here decolorizer is acetone or alcohol, ethanol. And here decolorizer is an acid, 20% sulfuric acid. It's very important MCQ. Coming on the secondary stain. Here secondary stain is red, right? And here secondary stain is blue or violet, right? So based on this, we divide the bacteria into two. Here also two types. Here gram positive, gram negative, and here acid fast and non-acid fast. Non-acid fast. This is the thing. Give me a thumbs up. Give me a thumbs up. Right. So you get MCQs on every line. You have to compare the two stains. The first thing. Okay, I'm not telling you the principle. So based on gram stain, what is the final summary? What is gram staining? Based on gram staining, finally the two types of bacteria are what? It's gram positive and gram negative. Right. The bacteria which are violet in the end, they are gram positive. And the bacteria which are red in the end, they are gram negative. Violet means they are retaining the primary stain. And red means they are taking the secondary stain color. That's why they are gram negative. So violet one are gram positive and red one are gram negative. So based on gram stain, this is the classification. Now based on shape of bacteria, how many types of shapes of bacteria are there? Some bacteria are circular, they are known as cocci. And some bacteria are elongated rod-like, they are known as bacilli. Right. Now compile the two classification together. Please compile. Gram positive, gram negative, cocci and bacilli. So if I compile the two classifications together, I will get four types of bacteria. What are the four types of bacteria? It's gram positive cocci, gram negative cocci, gram positive bacilli, gram negative bacilli. Give me a thumbs up, everyone. Everyone. I will try. Gram positive cocci, gram negative cocci, gram positive bacilli and gram negative bacilli. GPC, GNC, GPB, GNB. Give me a thumbs up. How many of you can help me in drawing? It will give you clues in the question. Come on. These both are cocci, so these are spheres, circles. And these both are bacilli, so these are rods. These are rods, right? So see, the two are cocci, the two are bacilli. We can see. Now based on the color, we will see. So this one is gram positive, so of course it's violet color. Let me fill it with violet. This is also gram positive. Let me fill it with violet, right? And these two are gram negative. So gram negative are red color. So let me fill this with red color. Let me fill this with red color. Now see how beautifully I have concised the concept in front of you. Now looking at the diagram, you will get image based question, like you will get a smear like this. Inside that you will get one of the four organisms. So how to identify a bacteria in image based question in microbiology? General clue. First see the shape, whether it is circle or rod. So is it cocci or bacilli? The first thing. Then see the color. Is it violet or red? Is it violet or red? Is it gram positive or gram negative? If it is gram positive, it is violet. If it is gram negative, it's red. Give me a thumbs up. Come on. Right. So this is how you have to learn. I will help you, Ajay. Wait a while. I will help you everything for classification, for learning. So first you have to understand that. Now the second thing, how many bacteria are there in each category? So gram positive cocci, okay, only two. SS, Staphylococcus, Streptococcus, that's it. Khatam baat. Staphylococcus, Streptococcus, that's it. GPC, only two. Gram negative cocci, again only two. NM, Neisseria moraxella, that's it. Neisseria moraxella, khatam. SS and M, Staphylococcus, Streptococcus, Neisseria moraxella. ठीक है. Gram positive bacilli, 5 in number. 1, 2, 3, 4, 5. A, B, C, D, L. ठीक है. A for actinomycetes, B for bacillus, C for clostridium, D for diphtheria, L for listeria. A, B, C, D, L. Done. Only 5. Now 2 plus 2 plus 5, 9 are there. Except these 9, remaining all are there. Don't learn the list. Remaining all, whatever. Maybe it is E. coli, maybe Klebsiella, maybe Salmonella, maybe Shigella, maybe Pseudomonas, maybe Rickettsia, maybe Chlamydia. The list is long. Don't learn. Learn remaining all. Except these 9, remaining all in the last category, the biggest category, gram negative bacilli. Give me a thumbs up, everyone. I tried hard. I tried hard. So this is the classification based on gram staining. So based on gram staining, we divide the bacteria into 4 categories based on gram staining as well as shape. We are compiling the 2 classification. The gram staining, gram positive, gram negative. The shape, cocci and bacilli. Compile the 2. So we have the 4 categories. The 4 diagrams are in front of you. And inside each category, how many bacteria are there? You have to learn the list. Learn the first 3 category. And the last one is gram negative bacilli. Don't learn it. So accept these, whatever coming left is there, that is coming in this that list. Shall I repeat? Okay, Shireen, I will repeat. It's A is actinomycetes, B is bacillus, C is clostridium, D for diphtheria and L for listeria monocytogenes. Right? Can we go ahead? Can we go ahead? Okay. So this is the same list in front of you. You all can learn it now very easily. It's gram positive cocci, only 2. Staphylococcus, streptococcus. Don't learn enterococci. That's it. Gram negative cocci, only 2. It's Neisseria moraxella, NM. It is SS and NM. Gram positive rods, gram positive bacilli. It's A, B, C, D, L. The full form is in front of you, A, B, C, D, L. Right? And remaining all. These are only few I have mentioned. Remaining all, don't learn the list. Remaining all are in the 4th category. Can we move ahead? Yes, right. Now, based on acid fast, I told you based on gram, we divide into 2 categories, gram positive, gram negative, and further we divide based on shape, GPC, GNC, GPB, GNB, 4 classes. But based on acid fast staining, we divide only in 2 categories, acid fast organism and non-acid fast organism, right? The acid fast organism are red in color and non-acid fast organism are blue in color. Acid fast are red in color because they retain the primary stain. Here primary is red, right? Ulta pulta hai, theek hai? And the non-acid fast are the one which retain the secondary stain, that is blue stain, methylene blue or any blue. Give me a thumbs up. Yes. So divide the category bacteria according to this classification. Here there are not 4 classification. Here only two categories are there. So I am giving you the list of 9-10 bacteria which are there in this list. Remaining all are in this. I'm not giving the list for the second one. So learn the bacteria which are acid fast. If I ask you how many bacteria you know acid fast, the first answer you will all give TB. Ma'am, TB is acid fast. Everyone knows that. Mycobacterium tuberculosis. If I insist, tell me more names, you will say leprosy. Uske baad koi kuch nahi bolta. Right? I take many vivas. So all the students say 1 or 2 names. But there are many. You should know the complete list. Come on. Right? So I will give you a mnemonic. Acid fast organisms. How many acid fast organisms you know? ठीक है? So this is the list in front of you. The acid fast organism. Right? The mnemonic is no longer separate booking. No longer separate booking. और तो हटा दो. RIM, RIM, SIM card. ठीक है? No का N stands for Nocardia. It's a bacteria. L stands for Legionella. It's also bacteria. S stands for Smegma bacilli. It's also a rare bacteria. We don't teach it, but yeah, it's a bacteria. ठीक है? B stands for bacterial spores. So it's not a bacteria. These are the spores of the bacteria. Right? Only 4 bacteria form spore. You know BSc chemistry. I taught you. So the spores of these 4 bacteria. Right? Retrograde हर चीज correlate करो, revise करो. RIM. R is Rhodococcus. Right? I is Isospora. And M is Mycobacterium. Rhodococcus is a parasite, right? I'm sorry, Rhodococcus is a, yes, it's a fungus, Rhodococcus. And S is sperm. Aage ka mnemonic, it's not visible here, na? S is sperm, human sperm, male sperm, sperm ka head, the head of a sperm, human head, sperm. And C is not visible here, you can write Cryptococcus, it's a fungus, Cryptococcus, right? So can you tell me the full form? No longer separate booking. No longer separate booking. For what? RIM, SIM. No longer separate booking, RIM, SIM card. So try to say the full form now with me. Can you tell me the full form? So this is bacteria, this is bacteria, this is bacteria, this is bacteria, and this is bacteria. These much are bacteria. This one is a parasite. This one is a fungus. And this one I will quote in others, human sperm. Neither bacteria nor human sperm is not a bacteria, fungus or parasite. So others. So can you tell me how many bacteria? It's Nocardia, Legionella, Smegma, bacilli and bacterial spores. And Mycobacterium. Mycobacterium both, tuberculosis also, leprosy also. Right? These are the bacteria. Among parasites, it's Rhodococcus. And among fungus, it's Cryptococcus. Right? Rhodococcus isospora also. Right? And S is sperm. Give me a thumbs up everyone. I tried. So these are the acid fast organisms. So we have done the 2 types of the staining. Right? In acid-fast staining, what was the decolorizer we have used? The primary stain was a red stain, followed by mordant is the heat. What is the decolorizer? It's 20% H2SO4, right? And then the secondary stain is a blue stain. We have seen that. Instead of 20% H2SO4, sometimes we modify the percentage. We modify the concentration of H2SO4, right? So let me tell you the modification in concentration. So standard we use 20%. Standard we use, again, I'm sorry. Standard we use 20% H2SO4, right? Standard we use that. I'm so sorry. But instead of 20%, we can use 5%, 0.5% and 0.25%. So learn the name of the bacteria. We use 5% for Mycobacterium leprae. We use 0.5% for Nocardia. And we use 0.25% for Cryptospora, Isospora and bacterial spores. Again, I'm repeating. You got my point? So write the mnemonic again. Can you tell me the mnemonic? No longer separate booking RIM, R-I-M, RIM, SIM card. This is the full form. Agreed? MA both are there. Mycobacterium TB and Mycobacterium leprae. I told you. Now for standard, all of them is 20%. But for Nocardia, it's 5%, not 20%. It's, I'm sorry, Mycobacterium leprae, it's 5%. Not 20%, it's 5% for Mycobacterium leprae. For Nocardia, it's 0.5%. It's 0.5%. And for bacterial spores, Isospora and Cryptococcus, these three, it's 0.25%. And remaining all is 20%. This is the summary. Give me a thumbs up. Give me a thumbs up. So standard पे भी PYQ है 20% और modifications also have PYQ. You should know the modification. Give me a thumbs up. Come on. Come on, right? So there are two types of mycobacteria, no? Tuberculosis and leprae. So leprae is 5% H2SO4, decolorized at 5%, but tuberculosis is at standard 20%. So can I use one line? Mycobacterium leprae is less acid fast as compared to Mycobacterium tuberculosis. Yes, Mycobacterium leprae is less acid fast. It is less acid fast. Can you read this line? Mycobacterium leprae is less acid fast than Mycobacterium TB, because here we require only 5% H2SO4 to decolorize it, but here we require 20% H2SO4 to decolorize it. Give me a thumbs up. Come on. Can we go ahead? Can we go ahead? So these all are your PYQs we are solving. Now, can we solve a question based on the staining? Can you help me in answering it? All of you, can you help me in answering it, please? Okay, just a second. Correct order for the gram staining. Who will tell me the correct order of gram staining? Apply. Primary stain, mordant, decolorizer, secondary stain. You know the steps. Who will tell me? The primary stain is a violet stain. Yes. So start with a violet stain. Yes, gentian violet, crystal violet. Any violet will work. Followed by iodine, which is mordant. Acetone alcohol decolorizer is not given here, followed by secondary stain. So A is the correct answer. If you see rest of the option, they are ulta pulta. So the correct answer here is A. It's a very important PYQ repeated many times in various exams, including FMG. So correct answer here is A. You all are right. Now can you tell me the next question? Decolorization of Zn stain. Zn stain is acid fast stain only. The same stain. Acid fast is known as Zn stain. Yes? Decolorizer, I'm coming on that. I'm coming on that, David. I'm coming. So decolorizer, yes. So I'm not mentioning any bacteria now. So I'm asking standard. If I mention any particular bacteria, you should think about that. If I have not mentioned anything, go with the standard. And the standard is 20%. Yes, go with 20%. But in the same question, if I add the word decolorization of Mycobacterium leprae, now what is your answer? What is your answer? Instead of D, your answer will change now. Your answer will change. Instead of 20%, it will become what it will become now for Mycobacterium leprae. If I mention the name of the bacteria, your answer will become 5%. Yes, your answer will become B in that case, right? And if I mention Nocardia, but option is not given, your answer will become 0.5%. It is not given in the options, but yeah, you should go for 0.5 for Nocardia. So in this way, various questions can come. Someone among you was asking to tell the sequence for acid fast stain. Na? So can you tell me the sequence? It will become reverse. Carbol fustian come the primary stain. So it will be carbol fustian followed by mordant. Here is not iodine. It will be heat. Followed by decolorizer is 20% H2SO4. Followed by secondary stain is a blue stain or violet stain. So it can be methylene blue or any violet stain. Give me a thumbs up. You got it? You got it? Yes, it starts from red. Yes, David. So can we move ahead? Yes. So there are many questions There are many questions based on the staining, the simplified staining. Acid-fast bacilli are stained by which stain? It's a very simple question. Is it Zeal-Nelson stain? Is it Albert stain? Is it Neisser stain? Is it Ponder stain? So yes, you all are right, of course. Zeal-Nelson discovered acid-fast stain, na? So that's why it is known as Zn stain. So correct answer is A. I guess everyone knows it, right? Coming on the next topic, next mnemonic. You know, there are few granules. Can you see this bacteria? This is a diagram of Corynebacterium diphtheria. Corynebacterium diphtheria, the diphtheria bacteria, right? Can you see the green color is the bacteria? The bacteria is of green rod. The bacteria is like this, green rod. But the thing is that they are angulated in the form of the V, L. They are angulated. Chinese letter arrangement. Am I live now again? I guess I got disconnected, no? I guess I'm live again. It's Chinese letter arrangement, the angulated appearance. Now, what is the reason for angulation? Okay, let me tell you, this is a bacteria. The bacteria is doing the binary fission. When the bacteria does the binary fission, two daughter cells are formed. But the daughter cells are not separated completely. That's why they remain at an angle. And it is giving the angular appearance, and it is known as Chinese letter or cuneiform arrangement. Chinese letter or cuneiform arrangement. The first MCQ on that. Okay. The second MCQ, these bacteria are green color. And at the end, at both the poles, they have granules. Can you appreciate the granules at the poles? So both the poles have granules, north pole, south pole. That's why these are known as polar granules. What are these polar granules? What are these? And which stain is it? The green bacteria with blue granules. The stain is Albert stain. This stain is Albert stain, right? So these all are your MCQs. The bacteria is Corynebacterium diphtheria. The stain is the Albert stain. On Albert stain, the Corynebacterium diphtheria is of green color, but the granules is of blue color. The granules are present at the poles, that's why known as polar granules. The bacteria is at an angle, that's why it is looking like Chinese letter arrangement. You got it? You got it? Now let me tell you a short note on these granules. The granules which are present at the end. So there are some bacterias. At the end of the bacteria there are granules, right? Since these granules are present at the poles, these are known as polar granules, number one, right? Number two, these were discovered by a scientist. The name of the scientist is very beautiful. It Babes Ernst, the name of the scientist. So that's why known as Babes Ernst granules. Babes Ernst granules. The second name, synonym, both are same thing. The third, it is discovered first time in a bacteria. The name of the bacteria is volutin, Spirulum volutin. That's why known as volutin granules. They are present in Corynebacterium diphtheria also. But first time they were not discovered in Corynebacterium diphtheria. They were discovered in volutin, the Spirulum volutin. That's why known as volutin granule, the third name. And the last thing, they are blue color, blue or violet or purple color. That's why known as metachromatic. Meta means bluish color, metachromatic granules. So all the four names are same. Either you say polar, or you say Babes Ernst, or you say volutin, or you say metachromatic. I am talking about these granules. Give me a thumbs up. You should know why these different names are given. There is a reason behind everything. There is a reason. Now tell me only three things about them. What is their composition? They are made up of what? Number one. Number two, tell me the name of the all bacteria in which these granules are present. Right? There are 5 bacteria. 1, 2, 3, 4, 5. Name them. And tell me the name of the stains by which we can stain them. One of them is Albert, but there are 4 stains. Tell me all 4. So tell me the 3 things about these granules. These all are your PYQs. Okay, I will talk about them one by one. Composition is phosphate. They are made up of phosphate. So it is the stored phosphate which is accumulated at the ends. They are made up of phosphate. Give me a thumbs up. It is a PYQ. So it's made up of phosphate. Why it is made up of phosphate? Usually when the bacteria divide into daughter cell, so phosphate is utilized in cell division, in the nucleic acid formation. But during starvation, if the bacteria is not dividing, so phosphate accumulate in the form of the granules. So basically these granules are formed at the time of starvation when bacteria is not dividing. So phosphate is not utilized. So where it will go? It will accumulate, right? So that is the composition. This is how you can learn. Number 1. Number 2, tell me the name of the 5 bacteria in which it is present. So I am having a mnemonic for you. The mnemonic is MHC Garden Agra. MHC Garden in Agra. So have you visited Agra? In Agra there is a garden known as MHC. No, it's not there. I'm kidding. I've just made a mnemonic just to fulfill it. It's not any garden. So MHC Garden Agra. So M stands for Mycobacterium. S stands for Spirulum volutin, in which first time it is discovered, right? C for Corynebacterium diphtheria. Garden is Gardnerella. Garden is Gardnerella. And Agra is Agrobacterium. So these are the 5 bacterias. These are the 5 bacterias in which this granules are present. Now, can you tell me the 4 stains by which we can stain them? Can you tell me? Yes, one of them is Neezer. Yes, Alia, you are right. But tell me more names. 4 names. The mnemonic is Plan. Plan, Plan. P for Ponder. L for Loeffler. A for Albert stain. And N for Neezer. Right, Loeffler is most commonly used to stain them. So this is all about this granule. You should know the various names given to them. You should know its composition. You should know the name of the bacteria in which they are present, and you should know the stains. That's it. So all the questions based on these granules, you can make it out. Give me a thumbs up, come on. So what are volutin granules? Volutin granules, also known as metachromatic granules. They are also known as Babes-Ans granules. They are also known as polar bodies, right? I'm really sorry. Give me a minute. Give me a minute. Okay, just a second. No, it will not disturb. Okay. Right, and they are made up of phosphate. They are the stored phosphate formed during the starvation. Right, now these are the 5 bacteria in which they are present. You can see the name of the 5 bacteria in which they are present. So the mnemonic is MHC Garden Agra. So M stands for Mycobacterium. S stands for Spirulum volutans, the first bacteria in which it is discovered. C stands for Cornybacterium diphtheria. Garden, Gardenella. And Agra, Agrobacterium tumefacens, right? And tell me the name of the stains by which we can stain them. The 4 stains. The mnemonic is Plan, P-L-A-N, Ponder, Loeffler, Albert, Neezer. These all are your PYQs. Now it will. Okay, I will help you in solving some questions. Can you help me in answering it? Can you help me? Metachromatic granules are stained by what? Metachromatic granules are stained by which stain? Is it Ponder? Is it negative? Is it Gram? Is it Leishman? What is the name of the stain? Yes, you all are right. Apply the mnemonic, na? It's Plan, right? So Plan ka P aa raha hai yahan pe. Answer is N is not negative. N is Neezer, right? Neezer. So correct answer is A, and you all are right. This is one of your PYQ, right? Okay. The next question is in front of you. Ulta question hai. Albert stain is used for which bacteria? Yes. So Albert stain is used for staining the metachromatic granules, and metachromatic granules are present in which bacteria? So MHC Garden Agra. So which among them is coming here? Which among them? So yes, C stands for Cornybacterium diphtheria. So correct answer here is Cornybacterium. So this is how the mnemonics will be useful in solving the questions. Can we move ahead? Right. Okay. The next mnemonic. Bipolar staining, also known as safety pin appearance. Have you seen safety pin at your home? I forget to put the diagram. Have you seen safety pin? In your dressing table, there may be a safety pin, na? It's a pin. It's a pin, safety pin, multi-purpose pin, right? So it's a safety pin. So there is some staining. It can be Gram stain, Albert stain, acid fast. So usually when we stain a bacteria, this is a bacteria, so stain is distributed uniformly in that bacteria, usually. But there are 5-6 bacteria inside which the stain is not uniform. It's accumulate at the poles. The stain is like this. Now this bacteria is looking like a safety pin. Safety pin. That's why it is known as safety pin appearance, or it is known as bipolar because the stain is at the 2 poles. So can you name the 5 bacteria having this appearance, safety pin or bipolar appearance? Give me a thumbs up. Have you understood what does it mean? Yes, I am coming. So yes, you all are right. You are saying different names, but I will give you a mnemonic for that. So safety pin or bipolar, 5 bacteria are there. Can you see this diagram? Yes, it's safety pin. Yes, let me show you. Appreciate the stain at the poles. Can you appreciate the stains at the poles? It's not uniform. It's at the polar distribution. Can you appreciate the stain at the poles? Yes, you can appreciate the stains at the poles. Right? Can you see this? Okay. So the mnemonic is in front of you. Safety pin can produce very high yield stain. This is the mnemonic. Very high yield. Safety pin, the mnemonic basically is this one. Can produce very high yield. The 5 bacteria can produce very high yield. Who can produce very high yield? Safety pin. So this is how you can remember that this is a mnemonic of safety pin. So safety pin can produce very high yield. So can stands for Campylobacter granulomatous. C. Produce ka P stands for Pseudomonas. Pseudomonas malai, Pseudomalai, both. Right? V stands for Vibrio. But mind my words, it's not Vibrio cholerae. It's Vibrio parahemolyticus. Right? High ka H stands for Haemophilus ducrei, and yield ka Y stands for Yersinia pestis. So can you help me? Safety pin can produce very high yield. Right? Can you help me in the full form, please? Anyone? Yes? C for Campylobacter granulomatous, P P for Pseudomonas malae and Pseudomolae. V for Vibrio, but not cholerae. It's Vibrio parahemolyticus. Yes. H for Haemophilus, but not influenzae. Please mind it again. This is Vibrio, but not cholerae. It's Vibrio parahemolyticus. In the same way, H is influenzae. H is Haemophilus, but not influenzae. It's Haemophilus ducrei. And Y is Yersinia. So it's very easy, can produce very high yield, right? Now, can you solve this question for me? It's one of your PYQ. It's one of your PYQ. Can you help me in solving, please? So, bacteria with safety pin appearance. The bacteria with safety pin appearance. Apply the mnemonic now. Can produce very high yield. It's as simple as that. So, yes, H is coming here also. But I have told you it's not H influenzae. No. It's Haemophilus ducrei. So, this is not the answer. Salmonella is not coming in this mnemonic. The two Vibrio are there. So, here Vibrio is parahemolyticus. So, I will go with B, not C. So, the correct answer here is B. Correct answer here is B. Posturella, I am not sure, Mohammed. I have to check. In this mnemonic, it's not coming. But if you are saying, you may have read it somewhere. So, I have to check it. Right? I'm not sure. So, correct answer is B and you all are right. Very good. Can we move ahead? Can we move ahead? Correct answer is B. Okay. So, okay, I would like to skip it. Yeah. Before ending bacteriology and moving to the parasitology mnemonics, the last thing I would like to discuss here, the bacterial growth curves. Many MCQs come. It's very simple. It takes 1 minute. Listen, there is a specimen. The specimen contains the bacteria. It's a bacterial suspension. It can be blood, saliva, CSF, urine, stool, anything. And this is my culture plate. This is my culture plate. I want to grow this over here, right? So, as soon as I will inoculate it here, my specimen, I have inoculated it here, 1 drop. So, it will start growing into colonies now. But first, if I inoculate it for the next few hours or minutes, it will not grow. So, that phase is known as lag phase. There is a lagging is there, lag. It will remain as it is. So, whatever you have put, that much only. It is not decreasing, it is not increasing, it is stationary. So, it is known as lag phase. After that, it grows exponentially, multiple colonies. It is known as log. Log ka matlab hota hai logarithm. Have you read logarithm in mathematics in your childhood? Logarithm is exponential growth. That is log phase. So, first there is a lag phase. Then there is a log phase. Right? After that, there is stationary. They will grow exponentially and they will remain stable. Neither they will increase nor they will decrease. So, this phase is known as stationary phase. Right? And after that, there is decline phase. The last phase, the 4th phase is decline. The colonies start dying. Many colonies, the bacteria inside the colony, they start dying. So, their number decreases, decline phase. So, these are the 4 phases. You can understand the reason. Can you tell me the reason why there is a lag phase? So, bacteria is preparing for doubling. For binary fission, it is preparing inside. That's why lag phase. And after that, log is exponential growth, right? Stationary means now all the nutrition present on the growth plate is already depleted. The bacteria have eaten them. Now there is nutritional, there is scarcity. Nutrition is not available for the bacteria. So bacteria will start dying. So whatever they are forming, they are dying. Whatever they are forming, they are dying. So number remains stable. Jitna ban raha hai, utna khatam ho raha hai. Kehne ka matlab. And after that, the decline will be more than formation. So their number overall is decreasing. This is the reason. So the graph will be like this. So as soon as you put the inoculum, it's constant. This is lag phase. After that, it's exponential growth. Right like this. It's log phase. And again, it becomes stable, stationary. It's stationary phase. And after that, it's decline phase. Give me a thumbs up. Everyone. So, first of all, an image-based question here can come and they can ask you to mark the phase, the 4 phases. Now, if you have understood it clearly, you can mark them. Give me a thumbs up. Come on. Have you got it? The 4 phases. So, it's lag, log, stationary, decline. This is the name of the 4 phases given. You can name them. IBQ can come. Number 2, they can ask the reason for each and every phase. You already know the reason, right? Number 3, they can ask you here, bacteria is not dividing, that's why number is stable. Here, cell division is there, that's why it's increasing. Here, the division, how many they are formed, the formation is equal to death. That's why number is stable. And in the last phase, death is more than formation. The death is more than formation, that's why the number is declining. That can be the question. Simple questions can be framed, right? The next thing, they can ask you this. The specificity for each phase. This is your PYQ. Multiple time it is asked. In the lag phase, there is maximum size of the bacteria, right? Okay. This is the growth plate. Now I told you. So you have put one bacteria here for the growth. Bacteria is not yet dividing. It's in lag phase. But bacteria will increase in size, increase, just about to divide to double. So maximum size of bacteria is in lag phase. is in lag phase because abundant of nutrition is available. Now it will eat everything and expand and then divide, right? So maximum size, go for lag phase. Go for lag phase if this is your question, right? In the log phase, logarithm, the cell will become smaller. They are dividing exponentially. They become smaller, but uniform staining. In the stationary phase, whatever formed, they will die. So number remains stable, but sporulation is seen and exotoxin formation is seen. These both are seen in stationary phase. These both are your PYQs. So sporulation and exotoxin seen in stationary phase, and in decline phase, involutional forms are seen. So you can get maximum questions. So you will get 4 options: A, B, C, D. Of course, you always have 4 options now. So it is lagged, log, stationary, and decline. These are the 4 options. Now question can vary. The question can be maximum cell size seen in. What is the correct answer from ABCD? What you will go for? Maximum cell size seen in. Write your answer in the comments. Come on, fast. Yes, the correct answer will be A. Sporulation is seen in. My next question. Sporulation seen in. What is your answer right now? Sporulation seen in. Yes. So answer will be sporulation seen in stationary. Right? Answer will become C. Or exotoxin formation seen in. Again, the answer will become C. Right? Involutionary forms are seen in. Answer will become D. These all are your PYQs. And image-based question can also come. Right? So you are prepared for the growth of the bacteria. Any question come, you can answer it. Right? The last thing is the bacterial toxin. I guess I must skip it. You already know about the bacterial toxins, no? I guess you know. Okay, let me tell you in short. Bacteria produce toxin. There are 2 types of toxin you may be knowing. Exotoxin. Can you see this bacteria? It is producing toxin outside the cell. It is secreting outside. The toxin is coming out of the bacterial cell, right, and causing the disease in humans. It is known as exo because it is coming out of the cell, out of the bacterial cell. That's why exo. The second type of the toxin is endo. What do you mean by endo? Endo actually is a part of the cell wall. It is a part of the cell wall of the bacteria. So when the cell wall, when the bacteria will burst, cell wall will burst, then endotoxin will come out. Otherwise, it is not secreted. This one is secreted, but this one is not secreted. It is a part of cell wall. It is a part of cell wall. You got my point? That's why it is known as endo. It is an endogenous part. You got my point? So exotoxin are protein in nature and endotoxin are lipopolysaccharide in nature. Right? So their nature is different. Their way of secretion is different. Exotoxin is produced by gram-positive bacteria. Endotoxin is secreted by gram-negative bacteria. Give me a thumbs up. So you should know the differences between them. I guess everyone knows the differences. Many MCQs come on this also. One more last thing here, blotting technique. I will give you a mnemonic here. You know what is blotting technique? The 3 types of blotting. Have you heard about it? Are you aware? The southern blot, the northern blot, and the western blot. Southern blotting is done to detect DNA inside a bacteria or any cell. Northern blot is done to detect the RNA of a cell. And western blot is done to detect the protein of a cell. You know? Yes, I am coming on that, Manisha. So what is the mnemonic? You will get confused in your exam. Which blot is done to detect what? So you know, in South, the dosa is famous. Dosa of the South. Have you eat the dosa of South? Right? So dosa and DNA. South ka dosa. Right? In the North India, roti is famous. Right? So roti is RNA. Right? And in the West, pizza is famous. So pizza is protein. So South ka dosa, North ki roti, West ka pizza. You will not forget now. South ka dosa, North ki roti, and West ka, it's pizza. So you can say it's DNA, it's RNA, and it's protein. Now you will not forget. Yes. So this is the mnemonic for the blotting, and you get simple questions on the blotting. Give me a thumbs up. Can we move ahead? Can we go ahead? The 3 types of the blotting technique used for detecting what? Yes, we can move ahead. Okay, I'm skipping this portion. Now let me give you a few mnemonics on the parasitology. Right? So I'm skipping the classification. I guess you already know the classification of entire parasitology. If I give you the classification also, it will take time. You revise classification, but it's very important. You cannot skip the classification. Okay. Most of the questions, many questions sometimes you get in parasitology is the largest and smallest in parasitology. So, in parasitology, broadly classify into 2 categories, the protozoa and the metazoa. You may be knowing that. Protozoa are the unicellular organisms and metazoa are the multicellular organisms. Metazoa also known as helminth, right? So, protozoa have multiple categories to be divided, but metazoa we divide into 3 categories, cystode, trematode and nematode. I guess this is the broad. I'm not enumerating the name of the parasites inside them, but the broad classification you should know. Now listen my 6 MCQs, 6 question. Can you tell me overall largest protozoa? Among all the protozoa, which is the largest? Can you tell me the largest metazoa? Largest. Listen my 6 question, then give me 6 answers. Largest protozoa, what is the answer? Largest metazoa, what is the answer? Largest cystode, largest trematode and largest nematode. What is the 3 different answers? Among them, who is the largest one in these 3? Which is the largest one, which will be overall largest metazoa? You got my point? And which is the smallest metazoa? The 6 question, the 6 answers, right? Now, students always get confused कि मैम largest कभी ये answer है, कभी वो है. I'm confused कि answer क्या है? So you have to read your question properly. What they are asking? Largest what? Largest protozoa कि metazoa? Among the metazoa, largest cystode ki trematode ki nematode. So there is a lots of confusion. So let me clarify it once for all. Once for all. So largest protozoa is Balantidium coli. The Balantidium coli, the largest protozoa. And largest metazoa is Taenia saginata. So one largest you learn. Among the protozoa, it's Balantidium coli, BC. है ना? Balantidium coli बड़ा. B से Balantidium, B से बड़ा. You know बड़ा. In Hindi बड़ा is bigger, larger. So बड़ा is Balantidium coli. And among metazoa, it's Taenia saginata. It's not solium, it's saginata, right? So now, who is the largest cystode, trematode and nematode? Largest cystode is saginata only. Taenia saginata, it is one of the cystode. Trematode is Fasciola busci. Again, B se bada, busci, right? And nematode is Ascaris. Nematodes is Ascaris, right? And, okay. Smallest you can leave. Smallest overall will be H. nana. Okay. Let me tell you the answers. So can you help me? Protozoa. Metazoa. The 3 types of the metazoa: cystode, trematode and nematode. Now let me tell you, who is the largest protozoa? Who is the largest protozoa? What is the answer? What is the answer? It's Balantidium coli, right? Who is the largest cystode? It's Taenia saginata, right? Who is the largest trematode? It's Fasciola busci. Fasciola busci. Who is the largest nematode? It's Ascaris. Ascaris lumbricoides, right? Now, who is the overall largest metazoa among these 3? This or this? So, answer will be Saginata only. So, Saginata will be overall. So, ये हुई largest की कहानी खत्म. This is all about largest. This is all about largest, right? Smallest, I will tell you overall smallest only. Overall, not in each category. Overall smallest. So, overall smallest is H. nana. H. nana. Nana se yaad karo nanha. Nanha in Hindi is small. So H. nana will be the smallest one, right? So this is the how you will get maximum MCQs, many MCQs on largest and smallest in parasitology. Give me a thumbs up. Now you know all questions. Largest protozoa, largest metazoa, largest cystode, largest trematode, largest nematode, and smallest overall metazoa. Right? Smallest protozoa we don't ask because protozoa are all unicellular. Na, ab sab unicellular hai, so they all are smallest. उनमें सबसे छोटा कौन है? We don't know. So give me a thumbs up. So that is the story we have done. Now we will do some mnemonics in parasitology. Can you tell me the name of the parasites which show antigenic variation? By the way, what is antigenic variation? Now in COVID era, we all know we have made the vaccines for the COVID, but they were ineffective because the virus was changing the antigen on the surface very frequently, right? In the same way, there are some parasites. This is a parasite. So on the surface of the parasite, we have antigens. So from time to time, they used to change the antigen. That is known as antigenic variation. So we cannot make vaccine for them, right? So how many parasites you know? COVID is a virus. How many parasites you know which show antigenic variation? There are 3 parasites. The mnemonic is GTP. GTP. G for Giardia, T for Trypanosoma, and P for Plasmodium. The three this thing. That's why for malaria we don't have vaccine till that, right? Malaria is very common now, but it is showing antigenic variation. GTP. Learn the full form and give me a thumbs up. These all are your PYQs, huh? I'm not helping you in solving the question now because it will take time. I'm having a limited slot. 20 minutes are left more. So in the 20 minutes, I want to give you maximum more mnemonics. Questions you can solve by yourself by opening your PYQs, right? Okay. Coming on the next mnemonic. Can you tell me the name of the parasites which penetrate human by penetrating the skin? So basically, when a human walks on the soil barefoot. Barefoot means without slippers, without shoes. Barefoot. This is barefoot. Barefoot on the soil. So in the soil, some parasites are present. some parasites are present, their larval form is present. They can penetrate the skin and they can enter the human body. So name such parasites which enter human via skin. You may have heard about them, right? So there are 5. The mnemonic is Hans, H-A-N-S-S, Hans. The mnemonic is Hans, right? So can you tell me the full form? H for Echinana, H, A for ankylostoma, ankylostoma duodenale. N for Necator americans, and S, strongyloids and cystosoma, right? So we have started parasitology. The first mnemonic I given you, the antigenic variation, that is GTP. The second mnemonic I am giving you, the parasites which enter human by skin. The mnemonic is Hans, GTP, Hans. We will revise again now. The third, can you tell me the name of the parasites which enter from male to female or female to male during sexual intercourse? So can you tell me name of such parasites? So if male is having, the male can infect the female partner, or the female is having, female can infect the male partner, like HIV. But HIV is a virus. I am asking about the parasites. Can you tell me 3 parasites which can transmit via sexual route? Sexual. So the mnemonic is GET, G-E-T, GET. That GET is a mnemonic. So you can learn like get it sexually, right? So G is Giardia. Again, G is Giardia. E is Entamoeba histolytica. It is an amoeba. And T is Trichomonas vaginalis. It is present in the vagina of female. So you can understand it can transmit sexually. No need to learn, right? So GET, G-E-T, GET. G-E-T, GET. Give me a thumbs up if you got it. So these are the name of the parasites which transmit by sexual route, right? Now can you tell me the name of 4 parasites? If any pregnant lady is infected by any of these 4 parasites and she is pregnant now. So this is the uterus, and inside the uterus this is the fetus. So the parasite can infect the fetus via placenta. So name 4 parasites which can transmit vertically. This is known as vertical transmission or congenital transmission. So the fetus can be infected congenitally because of those parasites. Can you tell me? So there are 4 parasites, right, which can transmit from mother to the fetus. So the mnemonic is PTTM, right? Have you heard about parents to teacher meeting? PTTM, parents to teacher meeting, PTTM, right? So you don't have kids, but I'm having a kid. So we usually attend PTTM, right? That is parents to teacher meeting. So PTTM is the mnemonic. P is Plasmodium. The 2 T, one is Toxoplasma, one is Trypanosoma. PTTM, M is Microspora. So these are the 4 parasites which transmit from mother. You can learn like mother to fetus, so parents to teacher, learn like that. So PTTM. PTTM is the mnemonic here. So these are the 4 parasites which transmit vertically, right? Coming to the next mnemonic, can you tell me the name of the parasites which are present in muscle of human? The name of the parasites which are present. So here for diagnosis, we do muscle biopsy. We can do the muscle biopsy. So there are 4 parasites, the 4T and 1E. The 4T. What are the 4T? The 2 are Taenia. Taenia solium and Taenia saginata. I'm sorry, these are not present in the muscle of human. Taenia saginata is present in the muscle of the cow. So someone is eating the meat of cow or buffalo, he or she can infect it, right? Solium is present in the meat of the pig, the muscle of the pig. So if someone is eating the pork meat, the pig meat, and it is not cooked properly or undercooked, so the person can have the infection of Taenia solium. Trichinella spiralis is present in pig, rat, human, everyone, and Toxoplasma is present in human heart. It's your PYQ. Human heart में it causes myocarditis, right? So the 4T, the 2 Taenia, 4 में से 2 तो Taenia हो गए. Taenia solium, Taenia saginata. One is in cow and one is in pig, pork, right? One is Trichinella, one is Toxoplasma. Toxoplasma is present in heart muscles, not in skeletal muscle. Rest all were in skeletal muscle. This one is in heart muscle. ये एक unique है जो heart की muscle में है, cardiac muscle, right? And E is Echinococcus granulosus. Right, it is also present in skeletal muscle. So these are the parasites which are present in muscle. Are you people still there, awaken or sleeping? Give me a thumbs up. Are you still listening or got bored? Yes? Give me a thumbs up. Okay. Just a second. Yes. So someone is listening. Okay, many people are there. Great, great, great. Right. So you can learn the mnemonic, the parasites present in the muscle. It's T4E. Right. Okay. Okay, so coming to the next mnemonic, okay, can you tell me the parasites causing malabsorption? The parasite present in the intestine, and whatever food the human will eat, the parasite will consume, and food will be not absorbed and person will be malabsorbed. So can you tell me the name of the parasites? 4 parasites causes malabsorption in human, right? So the mnemonic is, Gia is a girl and she is crying for a boy. The name of the boy is Philip. So strong Gia cry for Philip. It is a mnemonic, right? So strong is strongyloids. Gia is giardia. Cry is cryptosporidium, I'm sorry. And Phillips is Philippines. It is Capillaria Philippines. It is a parasite. So strong Gia, cry for Philip, right? So these are the name of the parasites which causes malabsorption. You can learn strong Gia, cry for Phillips. Give me a thumbs up. These all are your PYQs. Come on. Do you know what is autoinfection? So this is a human. Human gets infection from various sources. Either human get infection by ingestion, something, the food and water, the contaminated food, or by inhalation present in the air, dust particle, or through sexual route, or through skin by walking on the barefoot, or sometime human get infection from themselves. It is known as auto-infection, right? The source of infection is himself or herself. So how many parasites show auto-infection? The 5 parasites, very important, commonly asked. ये पिछले साल भी question है PYQ में, auto-infection. Auto-infection. The mnemonic is chest, C-H-E-S-T. C-H-E-S-T. C stands for cryptosporidium also and capillaris also, right? H stands for Echinana. Echinana was the answer last year, right? E stands for Antrobius, right? Another S stands for strongyloids and T stands for Taenia solium, not saginata. So the mnemonic is chest. Auto-infection का mnemonic क्या है? What is the mnemonic of auto-infection? It's chest. Can you write it down? It's chest. It's chest. So we will revise it till now. Can you tell me the name of the parasites which show antigenic variation? Just a second. Antigenic variation, 3 parasites. Tell me the name which show antigenic variation. The name of the parasite which can enter human via skin. The name of the parasite which can enter human via sexual route. The name of the parasites which can transmit vertically from mother to fetus and causing congenital infections in the fetus. Can you tell me the name of those parasites? Can you tell me the name of the parasites which are present in muscle of human? Can you tell me the name of the parasites which causes malabsorption in human? Can you tell me the name of the parasites which causes auto-infection in human? Now you can't imagine. मैंने 5 मिनट में कितने MCQs करवा दिए तुम्हें? You can't imagine. 50 MCQs we have done in just 5 minutes. If you open your book and do your PYQs based on these MCQ, you will get multiple questions on them. You can't believe, right? So can you tell me the answers? Please start saying the antigenic variation. It's GTP. I guess you know the full form. Right, it's Giardia, Trypanosoma and Plasmodium, GTP. The parasites which enter via skin is Hans. Hans enter with skin, Hans. I guess you already know the full form, Hans. Say yes. Can we move ahead? The parasites which enter via sexual route. What was the mnemonic? Get. G-E-T, get. Get it sexually. So get was the mnemonic. It's Giardia. It's Trichomonas vaginalis. What was E? What was E? It's Entamoeba histolytica. Yes. Right. So that is the thing. So can you tell me the name of the parasites which show congenital infection in the fetus or which can transmit via placenta from mother to fetus? So from mother I can remember parent to teacher meeting, PTTM. I can remember like this. So parent to teacher meeting, right? Give me a thumbs up. Yes. So can you help me in writing the parasites which are present in the muscle of any human or animal? So the mnemonic is T4, 1, 2, 3, 4, 4 T and E, one of the E. Right, so T is Taenia solium, T is Taenia saginata. One T is toxoplasma, which is present in the heart muscle, and one is trichinella, right? And one was E, Antrobius, right? Malabsorption, how many parasites cause malabsorption? What was the mnemonic? Can you help me in writing the mnemonic, any one of you? Strong Gia, cry for Philip, you know now, right? Strongyloides, Giardia, Cryptospora and Capillaris Philippines. So they cause malabsorption, I guess, right? Can you tell me the name of the parasites which cause auto-infection? Yes. So the mnemonic is chest. You all are right. Very good. The mnemonic is chest. H Nana is repeatedly asked from the chest. It was a PYQ last year also and before that also. Repeatedly asked. So you can't imagine how many questions we are cracking right now from the parasitology. Parasitology is a difficult portion and remembering the entire life cycle will be difficult for you at a time, right? So you can just revise the mnemonics and try it out. Maximum MCQs I can challenge will be from these mnemonics only. So they are very, very useful. Very useful. You can't miss it. So going ahead, अभी तो बहुत सारे बाकी हैं. Let's see how many we can cover today. Can you tell me the parasites which are present in brain? In the brain, they are present in brain of human. Only 3 parasites present in the brain of human. One is Taenia solium, which cause neurocysticercosis, the most common parasite causing seizures. neurocysticercosis. One is acanthamoeba, one is Naegleria. So learn these three neuroparasites, right? Okay, let me see, I'm having few more, just a second. You know what is a host? Okay, let me tell you this also. You know what is a host? What is a host? Can you define host? Okay, host can be human, can be animal, inside which parasite is present. So this is a parasite. The organism inside which the parasite is present, that organism is known as host. So this is host. Parasite get two things from the host. This parasite is getting two things from the host. Number one, nutrition. And number two, shelter. So parasite is residing inside the host and getting two things from the host. Number one, nutrition is given by the host. Number two, shelter is given by the host. And number three, on the return, what is parasite giving to the host? Disease. So दो चीजें ले रहा है और disease दे रहा है. So such an organism is known as parasite, right? Now host can be of two types, definitive and intermediate. Definitive. Can you define definitive and intermediate host? What is a definitive host? What is an intermediate host? So the definitions are different, right? Okay, let me tell you. Okay, sexual, asexual, adult or larva. I have told you now, there are two types of parasites. What are the two types? Protozoa and metazoa. We all know that, right? So definition of definitive host and intermediate host is different for both the categories. You cannot define them as equal, right? So for protozoa, the definitive host is the one in which sexual cycle of the parasite is taking place, and intermediate is one in which asexual cycle is taking place. So whether sexual cycle or asexual cycle, which cycle is present inside that particular host, that define whether it is a definitive host or intermediate host. Definitive host also known as primary host and intermediate also known as secondary. Many MCQs come from this, right? Say yes. Right? In metazoa, definitive host is the one in which parasite adult form is present. Adult form present, it's definitive. And if its larval form is present, it's intermediate. So it's not depend on sexual, asexual cycle. It depends on adult or larva. So see the definitions properly. You can imagine the questions in your exam. The first thing in parasitology, you should know the complete classification at the tip of your tongue, a crystal clear. Now, if I'm asking any question for any particular parasite like Taenia solium, you should know whether it is a protozoa or metazoa. Come on. If I'm asking for Entamoeba histolytica, come on, you should know it is a protozoa or metazoa. So for Entamoeba, what is the definitive host? What is intermediate host? For Taenia solium, what is the intermediate host? What is the definitive host? So you can define accordingly, and number of questions can be cracked or based on this concept. Come on. You got it? Give me a thumbs up. So for protozoa, what is the definitive and intermediate host? Definitive host is the one host in which sexual cycle is carrying out. And intermediate host is the one in which asexual cycle is carrying out. For helminthic or metazoa, helminth and metazoa are the same. Definitive host is the one host in which adult form of the parasite is present. And intermediate is the one in which larva is present. So don't get confused. Depending what they are asking in the exam, your concept should be crystal clear. There is not one definition of definitive host, they have two definition. Intermediate have two definition depending whether it is for protozoa or metazoa, right? So that is the first thing you should know. Okay, now I have told you there are some parasites which have only one host. They do not have intermediate host. There are some parasites which have two hosts in their entire life cycle, one intermediate and one definitive. But there are some parasites which have three hosts, right? Whenever there are three hosts, only one is definitive, remaining two are intermediate. Your maximum MCQs or PYQs are from this table. You have to learn the parasites having three hosts. And in the three hosts, what is the definitive host in them? What is the first intermediate host? What is the second intermediate host? You got my point? There are three possibilities. Either having only one host or two hosts or three hosts. If it is one host, it will be definitive. There is no intermediate host, only definitive host. If there are two hosts, there will be one definitive host, one intermediate host. But if there are three hosts, there is one definitive, one intermediate, one more intermediate. This is known as first intermediate, this is known as second intermediate. So your question can be on anything. Now learning this list and this list, it will be impossible. Even for me, it's impossible. If I say you learn all the list, but at least learn this one. Your question will be from this. Examiner don't ask question on this, they ask question on this list. So this list is going to be master list for you. Give me a thumbs up. So you have to learn this list, right? Maximum questions on Diphyllotum latum. What is the first intermediate host? What is the second intermediate host? This is your last year PYQ in FMG, right? So you have to learn this list anyway, right? Now in the complete list, you can see always definitive host is man. 99% time The definitive host is man. Can you see? 99% the definitive host is man only, right? But there are few exceptions in which man is not a definitive host. The man is an intermediate host. Tell me the name of those parasites in which man is not definitive host. Man is an intermediate host. Many questions come from this list. Can you tell me the name of those parasites in which man is not a definitive host but an intermediate host? The mnemonic is best pest. Best PST. Best PST. You can learn like that, right? So there are 2S and 2T, right? B stands for Babesia, है ना? P stands for Plasmodium. I can learn these two together. Babesia, Plasmodium, same category. Babesia, Plasmodium. 1E is Echinococcus. Now there are 2S and 2T. Can you see? The 2S and 2T. ठीक है? The 2S are Spiromitra and Sarcocystis. And the 2T, where is the another T? I can see only one. It's Taenia solium. Where is the other T? I can't find the other T. Toxoplasma, I'm sorry. Taenia solium and Toxoplasma. Yes. So you can learn like that. What's the mnemonic? The mnemonic is best PST. Best pest is the mnemonic. So in best pest, man or human is intermediate host, not definitive host. In best pest, human is the intermediate host. Learn the full form. You will get one question on this. High probability. It's a high probability. So many times question is repeated on this. Can we go ahead? Can we go ahead? Yes? Okay. Okay. Now I'm giving you a list. These were the mnemonics we have learned in entire parasitology. Now there is few list important for you. You will get big clinical questions now. So there are some pointers in the question that will point you towards a specific diagnosis. Just for example, in your big question, you are getting some line, there is some parasite causing solitary liver abscess. So answer is going to be Entamoeba histolytica. There is some parasite causing watery diarrhea and blotting. So answer is usually Giardia lamblia. There is some cyst in the brain. It is neurocysticercosis. So answer is going to be Taenia solium. There is one parasite which causes portal hypertension. So answer is going to be Cystosoma mansoni. There is one parasite which causes bladder cancer. So answer is going to be Cystosoma hematobium. There is one parasite which causes perianal itching or pruritus. So answer is going to be pinworm, that is Antrobius vermicularis. So this list is going to be important for big clinical questions. Give me a thumbs up if you like it. Give me a thumbs up. So we have done maximum mnemonics today. We have completed maximum mnemonics. We have seen many tests also. Now these lists are not very important. One more thing. Yeah. There are parasites, there are protozoa. In the protozoa, we have two forms, the cyst and the trophozoite. The cyst and the trophozoite, we have two things in the protozoa. We have protozoa and metazoa. So in the protozoa, we have a cyst and the trophozoite. There are only few parasites which don't have cyst, which have only trophozoite. So name 4 parasites which do not have a cyst. Only 4 parasites don't have cyst. They have directly trophozoite. So 4 parasites, don't learn this mnemonic, I am giving you a mnemonic. TTEV. TTED. TTED is the mnemonic, right? So there are 2 T. Taenia Trichomonas vaginalis, Trichomonas intestinalis, the 2 T. E is Entamoeba gingivitis and D is Dientamoeba fragilis. So many times question is on Trichomonas vaginalis. It doesn't have cyst form. So I guess we have covered maximum mnemonics till now, and few are still left, but I can provide the PDF, you can read by yourself. I would like to stop right now, right? So we have covered many mnemonics in the entire bacteriology, parasitology, virology don't have much mnemonics. But if I get more sessions before your exam, I will try to cover more mnemonics and more high yielding topics before that. And if you have any doubt, you can connect me. You can ask your doubts of the microbiology here on the platform with NLC team only, of course. And wishing you all the best for your exam, right? And I'm always there to solve your any query related to the microbiology for your exams. And my tip for you, do more and more revision before your exam of all 19 subjects. More and more revision. High yielding topics only, not the entire subject. It's not time to revise entire subject. Only high yielding topics. Now what are high yielding topics? High yielding topics are the one which are coming repeatedly in the form of the PYQs. So learn those topics. Questions will not be repeated, topics will be repeated. So thank you so much. Wishing you all the best for your exam. And if you have any doubt, you can write it here, and hope to see you again before your exam. Bye-bye. I'm ending this session.